All right, hello. So this week we are moving on to chapter 13, which is radiology and imaging services. So what we're going to learn about is the basics of billing and coding for radiology and imaging, how to or look at the procedural codes and guidelines, examine diagnosis coding for medical necessity, and determine how to apply the correct codes for radiology and imaging. So when we talk about radiology services, we're talking about services that use radiation to produce images of the inside of the body. Imaging services also produce images of the inside of the body and include radiology services, ultrasounds, fluoroscopy, and nuclear imaging. An independent radiology and imaging center is an office that specializes only in radiology and imaging techniques. So what happens is they receive a request or an order for the specific imaging procedure from a provider. They perform the imaging service on the patient, and then they send the images and/or imaging report to the provider. So imaging services are composed of two halves. First, who is performing the imaging procedure, and second, interpreting the results of the imaging procedure. So if you've ever had an X-ray or an ultrasound, MRI, or CT scan, you could probably understand this. You go in and you have a tech perform your imaging. They don't tell you anything during that visit because they are not the radiologist. They take the images, they send you on your way, and then a radiologist reviews it, sends the report to your doctor, and then you'll hear from your doctor about the results. So that's what I'm talking about here. All right, so sometimes these two halves are performed at the same time. So let's say your healthcare provider's office owns the equipment, performs the imaging service, then the healthcare provider interprets the images. But sometimes these two halves are performed separately. So the imaging service can be performed in an imaging center, but then the interpretation of the test performed by the healthcare provider at his or her own office. So someone else is interpreting it, not the imaging center. So these two halves are referred to as components. So you have your technical component, which is TC. This includes the equipment, supplies, clinical personnel, and other costs related to performing the imaging procedure. Then we have the second component, which is the professional component, PC. This includes the professional supervision, interpretation, and written report of the findings from the imaging service. Coding for imaging services depends on which component was performed. So they could either have done the technical component, professional component, or both, which is called the global service. It includes both the professional and technical component. So when it comes to coding, you report only the portion of the service that was performed by whoever you're coding for or by your office. Okay, to report the professional service, you would append modifier 26 to the code. So modifier 26, you'll see in your CPT code book. If you look on the inside cover, it says professional component. To report the technical component, that modifier is TC. That modifier you will not see in your CPT code book because it is not a CPT modifier. It is a modifier that's not listed in here. However, what I recommend on the inside cover of your book, get a pen out, write down TC and put technical component to help you remember that you need to use this for radiology services sometimes. Okay, so if the office does the global service and they do both the professional and technical components, so that would mean that they have the equipment in the office and they also have a radiologist on staff to interpret um, the imaging, then you do not report any modifier. You just report the code by itself. So appending either the 26 or TC modifiers do affect reimbursement. So the technical component gets paid at 60%, the professional component gets paid at 40%. Why is it important to use these modifiers? Let's say you don't use these and you have the imaging center trying to build a code without a modifier and the radiologist trying to build a code without the modifier. It will get denied because the insurance is not going to pay two providers 100%. They want to see these modifiers if that's the case because then they divvy out the payments based on who did what. Okay, one other thing that's important to notice is some code descriptions already include these components, so modifiers are not necessary. For example, if you look at like EKGs, which are in the medicine section, they start with a 9. It includes, it tells you, like it includes the tracing only, and then 93010 electrocardiogram, which includes the interpretation and report. So these, you wouldn't report any modifiers because it already says which part is included. Another example, this is in the radiologic section, code 74445, corpora cavernoros, I don't even want to say that, I'm going to butcher it, radiological supervision and interpretation. So no modifier needed there because it's already saying that they only did the supervision and interpretation. Okay, so here's just a little graphic image to kind of show you if the office just does the technical component, the TC modifier is added. If they only do the professional component, the 26 modifier is used. If they do both, there's no modifier. Okay, one other thing I just want to bring to your attention, the radiology section begins on page 515 in your code book, 515. Oh no, sorry. Ooh, wrong. Wrong. I'm sorry. It actually starts on page 521, page 521 in your code book. Okay, radiology codes start with a 7. So you can always recognize a radiology code because it always starts with a number 7. Okay, and if you look in your CPT book, especially want you to make sure you read the radiology guidelines, which starts on page 524. And it goes through a lot of the things I talked about already with the professional and technical component. Okay, so some terminology that's important, and I don't want to read this to you. Just know that it's in your book and it's on this PowerPoint. These are basic directional terms, so used to describe the general direction of a body part. So when they're doing like X-rays, these are the different types of views or directional views that they would be taking scans of. So you should remember this from anatomy and physiology, but if not, it's there for you. Like I said, I'm not going to read it all. Also, planes of the bodies. These are imaginary lines to dissect the body into sections. I'm also not going to read all of this, but you have an axial plane, a sagittal plane, and a coronal plane. And then projection. This is the direction in which the imaging rays pass through the body, also known as the view. So we have antero-posterior, posterior-anterior, lateral, and oblique. One thing I just want to draw your attention to, a lot of times when you are, I'm going to add this as I'm talking, when you are reading radiology reports, they usually don't say, antero-posterior or posterior-anterior. They usually say AP view or PA view. So I just wanted to add that on there. And then we have lateral and oblique. Okay, so here's an example. When we're talking about X-ray views, if you've ever had an X-ray, they usually make you kind of like turn your body around. I broke my ankle a couple years ago, and they had me do like stand straight. Then they had me like turn to the side so they could get a view of that. Then turn completely around so they get a back view. So this is what we're talking about, the different views so that they could really see what's going on. So this is a chest X-ray, and this is kind of showing you the PA view and the AP view. So you'll see how you get different, it looks a lot different views based on the view they take and the way the patient is standing. Okay, here's a couple more pictures that are in your book of different, views they may take. Okay, so diagnostic radiology is the largest subsection of the radiology section in the CPT book. These codes identify radiology services used to obtain a diagnosis. In your code book, one thing I want to stress is when you're looking for X-ray, you could also look under radiologic exam. A lot of times, they may say radiologic exam of the chest. When they're saying radiologic exam, that means X-ray. Okay, and an X-ray creates an image of the denser structures within the body, such as bones. Okay, so X-ray is very common for bones. And the codes describe the area pictured and the number of views included in the procedure. Okay, we also have CT scans, computed tomography. These are also known as CAT scans, computer axial tomography, and these combine multiple x-rays from different angles to produce a cross-section image. Okay, here's an example of some pictures. We also have MRI, so magnetic resonance imaging. This uses strong magnetic fields and radio waves to produce detailed images of the body's internal anatomy and physiology. So it could look at vascular structures, soft tissues, so way more detailed scan than like an X-ray or a CT scan. Okay, contrast material, this is important. You will notice in the codes, so in radiology, it's very important to pay attention to what the code says. So the code will tell you what type of radiologic exam they did. And then they will, for x-rays, it'll include, there's different codes based on the number of views of the same body part. And then for like CT scans and MRIs, the codes include use of contrast material or no contrast material. So very important that you're selecting the right code. Contrast material is a substance injected into the patient to enhance the imaging procedure. It can be given orally, rectally, or via injection. Only contrast that is given, you could do intra-articularly, which is into a joint, intravascularly into a vessel, or intrathetically into the spinal canal. So any of these are considered with contrast. All right, so like I said, very important when you're coding for CT scans or MRIs, there usually are 3 code options for each body area. So it could be like a CT scan of the abdomen with contrast would be one code. Without contrast would be another code. With and without contrast, this is if they do it. So usually what they do is they'll do an image without the contrast, and then they'll have the patient drink the contrast or they'll inject it into them. Then they'll do the same imaging with contrast. So it just kind of shows you. So why do they do it without first? Once you take the contrast, things start to glow. So you'll see here, here's an example of, without contrast. And then after contrast, look how much more they can see, things that are lighting up. So they always do that second with the contrast. Okay, but very important because there are 3 different code options. So you want to make sure you're selecting the right code based on what they did. So one thing that's very important, if they do with contrast and without, there's a code for that. There's a code that includes both. You wouldn't code 2 separate codes for with and 2 separate codes or another separate code for without. That would be considered unbundling because there already is a code that includes with and without. Okay, ultrasound is also in this section, and ultrasound codes are 76506 to 76999. Ultrasound is known as a sonogram. They use high-frequency sound waves to create an image. Most commonly, people think of ultrasound during pregnancy, but also used for a lot of different reasons as well. Doppler ultrasound uses color mapping during the procedure to visualize blood flow. Codes identify the type of ultrasound technique and the area viewed and the extent of the imaging service. Also note there's codes for obstetrical versus non-obstetrical ultrasounds in the pelvis section, so you definitely don't want to be selecting a obstetrical ultrasound if the patient is not pregnant. Okay, these are the types of ultrasound scans. There's A mode, M mode, B scan, real-time scan, and Doppler ultrasound. So these words are exclusive to ultrasound. So if they don't say ultrasound in the note, but they say A mode scan or M mode scan, you know they're talking about ultrasound. Here's a couple pictures. You'll see, an ultrasound image when they're looking for a gallstone, ultrasound of a fetus, and then here's a Doppler one where you could see it's like color mapped because they're trying to look at the blood flow and if there's any issue in the heart. Okay, radiologic guidance procedures are performed together with an invasive or minimally invasive procedure to help guide the procedure. There are 3 types: fluoroscopic, CT, or MR. Codes identify the type of guidance in the primary surgical procedure, and there are add-on codes that are added to the code for the primary procedure. So if they're performing a procedure with radiologic guidance, you want to make sure you report that. Mammography is also in this section, code 77046 to 77067. This is X-ray imaging of the breast to diagnose breast conditions such as tumors or fibrocystic breasts. So the code depends on the specific type of procedure and laterality. Diagnostic mammography is performed when the patient has signs or symptoms of disease, and then screening is performed on a regular basis with no symptoms present. So this is just your screening mammography that, women start doing at a certain age. Bone and joint studies are also in here. These are special studies of the bones to help diagnose conditions of the bones, such as osteoporosis, bone age, bone growth, and bone tumors. The code set's 7071 to 77092. Radiation oncology, 77261 to 77799. These are cancer radiation procedures to treat cancer conditions. Okay, we'll talk more about this in chapter 18. Nuclear medicine uses small radioactive elements that are introduced via intravenous injection so that those elements travel to a specific organ or body area, and their emissions are captured with a nuclear medicine scan. What this does is help to visualize cancers and functioning of organs and body tissues. There's a couple different types. There's a PET scan and a SPECT scan. Code selection depends on body area or organ system, the extent of the procedure, and special nature of the test. Okay, here's an image that's in your book. It kind of shows you how nuclear images work. Okay, so we talked earlier about the different component modifiers. So we're going to do an example of like how to use modifier 26 in TC, but also in addition to the professional and technical component, you also will very often be using the laterality modifiers for radiology. So like if they're doing an x-ray of the right ankle, you would put RT. If they're doing an x-ray of the left knee, you would do LT. So definitely use these laterality modifiers. Distinct procedure service. This is the fun modifier that's driving everyone crazy. And just know that it drives experienced coders crazy as well. So it's not just for new learners. But modifier 59 is a distinct procedural service used when additional imaging services are performed on different body sites. We also have repeat services. So this is pretty common. These are additional imaging services performed to verify the location of the internal structure of the body. So for example, modifier 76 can be used a repeat service by same provider, or modifier 77, repeat service by another provider. So one way this is used, so I can use myself as an example. When I broke my ankle, they did an x-ray right away to determine, do I need surgery or was it a non-displaced fracture? Luckily, mine was not displaced enough to need surgery, but they needed to do the x-ray before, and then the orthopedic surgeon determined, okay, we could just cast it and it'll heal fine. So then they casted me and put, stabilized the fracture. Then after they stabilized the fracture on the same day as the initial x-ray, they did another x-ray because they wanted to make sure that the cast had my bone stabilized so that it would heal correctly. So in that case, they had to repeat the x-ray. So the first x-ray would be billed, and then the second x-ray would be billed with the 76 modifier repeat service by the same provider to show they did 2 separate x-rays that day. Okay, so like we talked about, the x-ray procedures technical component. This is whoever owns the equipment, hires the technician, and provides the supplies for the x-rays. And then professional components is usually the radiologist or whoever is reading and interpreting films. Okay, so when it comes to coding, it's important to determine who is responsible for the professional and technical components. Professional and technical components are reimbursement issues like we talked about. The technical component would be reimbursed at 60%, where the professional component is at 40%. Okay, a couple different coding tips. Modifier 50, the bilateral procedure, not added to radiology procedures performed bilaterally. Why? Because most code descriptions often specify if it's bilateral. So if it says that it was an x-ray of bilateral knees, you wouldn't append modifier 50 because it already states bilateral in the description. Modifier 51, multiple procedures, not usually added to radiology codes. So if the patient has like 5 x-rays, you just code the 5 x-rays, no modifier 51 needed. Modifier 51, multiple procedures, is used in the surgery section not radiology. Okay, and like I said, LTRT definitely used in radiology. Okay, so here's an example to practice using the professional and technical components of the X-ray codes. So here's an example. A patient is seen by her chiropractor who evaluates her back pain. The chiropractor takes 3 views of her thoracic spine. He sends the X-ray to a radiologist for interpretation. Okay, so in this scenario, I'm asking what will the chiropractor code and what will the radiologist code? All right, if you want to practice coding this on your own, pause the video at this point. Otherwise, I'm going to the next slide. Okay, so in this case, the chiropractor would code the technical component because he took the X-ray, provided the X-ray machine, the supplies. So he would code 72072 with the TC modifier. Then the radiologist would bill for the professional component, which is 72072 with a 26 modifier. Okay, so now we're going to move on to diagnoses for imaging services. So imaging studies performed to determine a diagnosis usually is due to an injury, a disease process, progression or remission of disease, healing status, or fetal growth. If there is no definitive diagnosis, then report the code for the sign or symptom that prompted the imaging service. You do not report a diagnosis that is possible, questionable, rule out, or suspected. Okay, we never code those types of diagnoses. If you don't have a final definitive diagnosis, just code the sign or symptom. Okay, we already said that. Some common diagnoses for the lungs, let's say pneumonia, J12 through J18, pleural effusion, J90 to J91, pulmonary edema, J81, abnormal findings of the lung, R91. Okay, imaging studies can help diagnose conditions of the breast. So in this case, we would have, maybe it could be a cyst, a malignancy, fibrocystic changes, hematomas, lipomas, mastitis. In this case, you could use a Z code to identify a mammography encounter. So Z12.31, encounter or screening mammogram for malignant neoplasm of breast. And then there's also abnormal findings of the breast, which is in category R92. Cholelithiasis and nephrolithiasis. So this is for gallstones and kidney stones. This can be diagnosed usually via ultrasound and sometimes with like a CT scan. Fractures, these are imaging services determined if a fracture is present, which bone is involved in the clinical aspects. So very common for orthopedics, and we'll be going through orthopedics in chapter 15 next week. All right, that is radiology in a nutshell. Hope that the examples I gave are helpful. Yeah, that's chapter 13. Thank you.